Well, more now on our top story, where 116 countries are calling for an independent investigation into the origins of COVID-19. Health ministers from around the world have backed the resolution as the World Health Assembly began. The draft resolution by the European Union comes on the back of a push by Australia to examine China's handling of the crisis. Dr. Annelies Wilder-Smith joins us now for more, and she's visiting professor at the Chian School of Medicine at Nanyang Technological University. Thank you very much, Dr. Wilder-Smith, for joining me. First up, how would an inquiry into the origins of COVID-19 be helpful at this particular stage while the rest of the world is still trying to battle the coronavirus?
At this particular stage, it's most important to focus on battling this epidemic rather than focusing on geopolitical strife. Obviously, in the long run, it is important to understand the origins because it has implications also how we avoid another pandemic.
Well, the issue of Taiwan's seat at the table has been sort of put back on the shelf for now. Is it important for Taiwan to be recognized by the WHO, and what would the WHO stand to gain from it?
Taiwan had an extraordinary good response, and I think the world stands to learn from how Taiwan has battled or has successfully contained this epidemic. And there obviously are geopolitical considerations that I also do not fully understand, but I think there should be a move to include Taiwan.
Well, the WHO, we know, has come under much criticism for its response to the pandemic. Should there be clearer guidelines for its role, perhaps as a global coordinator, especially when countries are each, like we mentioned, they're tackling the situation, and it looks like they're tackling it in their own way, something that we can learn from Taiwan, that's something different from what Europe is doing as well.
I mean, we need to restate that WHO is the guardian of global health. And now more than ever, the world needs WHO. WHO was very quick in acknowledging this outbreak and in setting out guidelines and principles how countries should react. Obviously, there are different needs in every country, and every country will adapt or tailor-make those or modify those guidance to their own countries. But the principles that WHO set out from the very beginning, they still stand today.
And countries collaborating better in this fight against COVID-19, that is the goal, particularly in terms of producing test kits, researching treatment options, as well as finding a vaccine. It must be frustrating for watchers like yourself to see sort of political agendas and politicizing of the virus come into play, especially when it involves and drags the WHO in as well.
At this time, we really need a global response, and we should not waste our time on geopolitical arguments. This is not the time. This is the time for the world to come together and to work together. Every country has a different contribution. For some, it's the know-how. For the others, it's supply chain. For the others, maybe access to clinical samples and phase 3 trials. So we need to work together now more than ever.
Dr. Wilder-Smith, what's critical at this point as we know that countries are slowly starting to lift their lockdowns?
WHO has spelled out 6 criteria when a country can consider easing the strict lockdown measures. And the most important, obviously, is when the epidemic curve is clearly on the bend. That means a consistent decline in cases down to just sporadic cases or clusters. And the second, the ability of a country to have the testing and to test liberally so that they can early identify a new hotspot. And the third is to have the ability to do contact tracing. I think where especially Europe and the US has lagged behind is in scaling up their contact tracing abilities. I third, that we have all the mechanisms in place to shield, to protect the most vulnerable, the older aged people, the sick. And fifth criteria the WHO set out is that workplaces, if they want to restart work, that they must have preventive measures in place allowing for physical distancing and hand washing to continue. And the last one, I think, is the message, the public message to all of us. Behavioral changes that have now started must in some way continue. We cannot lax on social or physical distancing.
You mentioned the vulnerable just then. COVID-19 has also been spreading to vulnerable areas such as the Rohingya refugee camps. What do you think should or can be done to ensure that these places have sufficient resources to tackle the outbreak?
So indeed, the COVID-19 pandemic spotlights the weaknesses in all our societies, be it the migration, the migrant populations, be it countries where there's a high disparity between the rich and the poor. And the more marginalized populations, as the Rohingya, as you mentioned, they will need more support. They will need more financial support. They need to have secured access to food and to healthcare. And this demands also a global response.
Okay, thank you so much for speaking with us this evening and sharing your thoughts with us. Dr. Annelies Wilder-Smith, a visiting professor at the Chian School of Medicine at Nanyang Technological University.